the Horsforth Dental channel. Today we're going to be talking in more detail about gum disease, how it progresses and the things you can do at home to keep it at bay. As you can see, I've been working quite hard on my Blue Peter badge this week and we've come up with this wonderful model which is hopefully going to help me explain things to you, point you to some of the key features. This is the crown of your tooth and the root, which should be tucked nicely in its socket. This is your gum, or as we like to say, your gingiva. This striated area here, that's your periodontal ligament, the attachment of your tooth to your bone, and this polka dot area, that's the bone of the socket itself. On this side, we have a nice healthy gum. The level is right, it is a nice light pink colour, and if it were to be examined, there would be no bleeding or pocketing. Now, if you have a look over on this side demonstrates gingivitis, which is first stage gum disease. What's happened here is there's been a build-up of plaque, we call that a biofilm, which has bacteria in it, and the bacteria has been irritating the gum line and you get an inflammatory response. That's why it can appear a little bit puffy and also an angry red colour. At home, a patient would notice when they're cleaning that area will bleed quite easily, and therefore what often happens is they shy away from cleaning that area because they don't like to see the blood. However, that's actually the wrong thing to do. If there is a bit of bleeding when you're cleaning, then this area needs to be kept really well and thoroughly clean for a couple of weeks, because gingivitis is completely reversible, and with good cleaning you should aim to get back to these nice healthy gums. If you remember from a previous video, I like you to make sure you're holding the bristles of your toothbrush at 45 degrees, lots and lots and lots of little circles, and flicking up from the tooth. That angle will help you angle some of the bristles into the little crevice down the side of the gum and keep that area really nicely clean as well. And remember, go from both sides. And make sure you're using your interdental cleaning aids. You can use these brushes or floss, and they will help you protect the gum line in between your teeth too. So remember, gingivitis is reversible. Don't shy away. Get in there, be thorough and gentle, and after a couple of weeks, the bleeding should disappear. And that's how you know you've got on top of that. If we allow the gingivitis to continue and oral hygiene stays poor, then there is a chance that it can progress to the more serious form of gum disease, which we call periodontitis. This is significant because at this point it becomes irreversible and we can't get back any of the gum that we might lose. All we can do is identify it and try and stop it getting worse. So there's about a 10 to 15% chance that gingivitis will progress to periodontitis. Some patients are more at risk. There are patients with underlying health conditions such as heart disease or diabetes, patients with a genetic predisposition, or smokers. And our job as clinicians is to try and identify any of these risk factors, warn the patient that the gums are at more risk, and try and get their oral hygiene tip-top to hopefully prevent this from ever happening. One of our jobs when you come to see us is to check the health of your gums, and to do that we have a little instrument called the BPE probe, which has a little ball at the end, and we gently walk this round your gum line, checking for signs of inflammation and any plaque build-ups. More significantly, we are looking for things we call a periodontal pocket. Now, we shouldn't be able to measure past 3 millimeters into that little gingival crevice down there, but when a pocket is emerged, we can measure it a little bit deeper, and that's a sign that gingivitis has progressed to periodontitis. That's significant because any damage from here on out is irreversible. We won't be able to get this gum back, but we can stop it getting worse. So we will advise any patients where we find pockets to have a really, really good clean. Then their maintenance at home must be tip-top, good cleaning, good interdental cleaning, and we would advise that they see our hygienist a bit more regular so that the hygienist can clean under the gum line for them. The pocket itself is significant because it provides the perfect breeding ground for the bacteria to further irritate the gum line. It's also really difficult to clean, and you might get the formation of subgingival calculus deposits. Now, this is plaque that has solidified. It has a rough surface area, so more plaque can accumulate here and further exacerbate the situation. It's our hygienist's job to spot this subgingival calculus, clean it all off and make the area easier for you to maintain. As the condition progresses, the gum will shrink back further and we end up with a deeper pocket which we'll be able to measure clinically. The gum remains inflamed, and more significantly we're losing bone height here. Now we should pick this up on an x-ray and be able to warn patients of this, but ideally we want to catch it as early as possible. The earlier we catch it, the less bone is resorbed. As the condition progresses, we might end up with deeper subgingival calculus, and we end up at end stage periodontitis. Here we have a much larger pocket, and most significantly we've lost a lot of bone here, and therefore we've resorbed a lot of periodontal ligament. A patient with end stage periodontitis might present with a loose tooth because there's just not much left holding it in. In summary then, periodontitis is a progressive and irreversible disease, so we need to catch things as early as possible to improve the long-term prognosis of the tooth, and that's done with super duper cleaning from the get-go. A quick word then about dental implants. Dental implants are attached directly into the bone and we lose our periodontal ligament. This makes the whole area much less robust and more prone to periodontal attack. So it's really, really important that this area is kept super clean at home, and patients with implants should have regular hygiene visits so that this area can be maintained as best as possible. Because this area is less robust, periodontal disease will progress much quicker than a normal tooth, so it's important that the implant is checked regularly so we can pick it up at its earliest possible sign. Wow, there have been a lot of information there today. I hope you've enjoyed the video, and I've really enjoyed making it, and I'll see you next time on the Horsforth Dental channel. See you later.